Hi everyone, I'm Dr. Alejandro Castro, and welcome back to another episode of the Vet Boards Preparation Series. Today we're talking about a very common situation in general practice, and since we're preparing for board exams like the NAVLE, we will have a multiple choice question to practice today. So maybe some or most of you are familiar with this test, the SNAP 4DX from IDEX, which is used in most veterinary clinics to test for heartworm and tick-borne diseases. You've probably also heard someone say, "Oh, there's no need to run it, the dog is too young for heartworm testing." But do you fully comprehend why that is? Well, let's find out using a multiple choice question. According to the American Heartworm Society, why is routine heartworm testing not recommended for dogs younger than 7 months of age? So here are the possible answers. A. Testing too early can lead to false negative results because the antigen test lacks sensitivity before adult female worms develop. B. False positive results are common in puppies due to cross-reactivity with other filarial parasites. C. The specificity of antigen tests is reduced in dogs under 7 months because of maternal antibodies. Or D. Puppies rarely have circulating microfilaria before 9 months, making microfilaria tests unreliable. Take a second to think about it. Which one would you choose if you were taking the test? Pause the video if you need more time to think. Okay, so the correct answer is A. Testing too early can lead to false negatives. Not because the test is inaccurate, but because the worms simply have not matured enough to produce detectable antigen. So the antigen tests detect proteins secreted mainly by the adult female. So remember that. That's key. And a positive result indicates the presence of mature worms. So when a mosquito infects a dog with Dirofilaria immitis, which is the larva of heartworm disease, the larvae migrate and develop over several months. So the L3 larva enter the animal's body through the puncture wound made by the mosquito, as you can see in the picture. And the larva tree begin to develop in the host tissues. Eventually, the L3 mold into the fourth stage, and there is an early migration phase, and these L4s, they undergo a final molt. And after this final molt, the sexually immature adults enter the circulatory system and are transported toward the heart and lungs. By day 67, the immature adults, they reach the pulmonary arteries, and they don't become sexually mature until about 4 months. So that's why you have to remember, adult female worms are the ones that produce the antigen detected by the SNAP test, and that's why we usually go with that statement of not testing before 6 or 7 months of age. So that means that the antigen doesn't show up in the blood until roughly 5 to 6 months post-infection. So if you test before that, even with a great test, you are likely to get a false negative, simply due to low test sensitivity in that early period. So the Heartworm Society specifically states that there's no justification for routine antigen testing before 7 months of age. So the next time you hear someone say, "We don't need to test that puppy yet," you'll know exactly why. It's not about clinical protocol. It's about biology, timing, and test sensitivity. No adult worms means no antigen, and that means no positive results, even if the infection is already underway. Don't forget to subscribe for more sure and educational videos, and comment below if you'd like to see a follow-up episode on interpreting antigen tests, sensitivity and specificity in real case scenarios. See you in the next one. Bye bye.